Welcome back, everyone. We've been talking about Piedmont Augusta Foundation's upcoming 39th annual Jernigan Memorial Golf Tournament, with funds raised going to support colorectal cancer patients at our community hospital, Piedmont Augusta. It has the largest group of colorectal surgeons in the region, and they want everyone to be screened appropriately to prevent colorectal cancers. Piedmont's Chief Medical Officer is colorectal surgeon Dr. Barry Jenkins. I'm so glad you're here with us today.
Thanks for having me.
Thank you for your time. This is such an important mission. It's such an important cancer to talk about, and the funds that are being raised through this tournament, because colorectal cancer now, I think it's the second leading cause of death for cancers. Isn't it also one of the most treatable if it's caught early?
It is. So it's the second leading cause of death behind lung cancer and the fourth most common cancer overall in the United States. Unlike many of the other cancers, it can actually be cured or even prevented if screening is done early, because we can actually find polyps before they turn into cancer, which is a pretty unique situation and just screams of the importance of screening.
And the screening really isn't bad. I mean, the prep day is the hard part of that screening.
Yeah, it's the one nobody wants to talk about. And there are a couple of options for screening. Colonoscopy, which you're referring to, is still the gold standard, because you can both identify or diagnose and then often treat if you find a polyp that can be removed with colonoscopy. There are other screenings you can do.
Yeah, you see the commercials.
That's right. There's some home tests that you can do. And really what we recommend is that each person's indications are a little bit different. It's important that they talk to their primary physicians about which is most important for them.
When you're talking about some of the indications, I mean, are there symptoms that would lead people to a doctor like that?
Yeah, so unfortunately, colon cancer usually does not present with symptoms until it's too late to prevent it or even sometimes treat it early. It's usually in later stages when you have symptoms.
Oh, so that's why you hear when people say they have it, they'll say it's a stage 3 or it's a stage whatever.
That's right. We usually find it for the early ones through screening.
Yeah.
And so usually once people start to have symptoms, then it's usually progressed further and is still often treatable, but certainly much more difficult.
Yeah, a lot harder for the patient at that point.
Right.
For sure. Isn't it true that the screening guidelines are changing a little bit and the age to start screening?
Right, yeah, so what people have been familiar with in our country for many, many years was that you start at 50.
Right.
In the last decade, those have gradually changed. We now recommend starting screening at age 45. Again, for most people, it's really important to know your family history. So you need to talk to your parents, your grandparents, your siblings about this, because different things in a family history can sometimes trigger the need for earlier screening.
Even earlier than 45.
Even earlier than 45. But for general population of patients, age 45 is when you want to start. And we don't worry as much about how you get screened, it's that you get screened. Whether it's colonoscopy or one of the home stool test kits, it's just important that people get screened.
Okay. Really, really important. And you've talked now about those different screenings that are available. What happens after a colonoscopy? Do you get a letter in the mail that says, all good, or do you find out the day of the treatment, the screening itself?
Yeah, so the beautiful thing about colonoscopy is we at least know if we find polyps after. So if you have nothing, in a perfectly clean colon, then we can tell you we'll see you in 10 years unless something changes.
Yeah.
If we find polyps, then we would generally tell you, this is what we found. We think it's worrisome or not worrisome, and then we would have a follow-up letter and phone call with those results afterwards.
Okay. But you are right, because you're seeing it on a screen as you do it.
That's right.
Yeah, and I guess we thank Katie Couric for that.
That's right.
Because she did that years and years ago.
Certainly brought a lot of attention to the importance of screening, yes.
Good. And like you said, it's one of the cancers that's awkward to talk about.
Right.
Yeah. And it's important to raise awareness about it. And I love it how the Jernigan Foundation tournament, the Jernigan Memorial Tournament helps to do that and to shed light on the different diseases that the funds are going to help support.
Right. Yeah, we're really excited that we've sort of partnered this cause with the Jernigan this year. Because again, to be a cancer that is preventable if you have appropriate screening, still about a third of people who are eligible for screening do not get screened in time. And sometimes there are barriers to that, and so the funds that we'll raise through the Jernigan will certainly help that group of patients. We're fortunate over the last 2 decades, the incidence of colorectal cancer has gone down in this country. With the one exception, in the group of patients under 40, we've actually seen a 90% increase in the incidence of cancer. And we don't know why those younger patients are getting it. There are a lot of theories out there, but what we do know is a healthy diet, particularly a high fiber diet, healthy lifestyle with exercise and just general taking good care of yourself, avoiding smoking, too much alcohol, those type things are associated with lower risks of cancer.
Such important information. Dr. Barry Jenkins, thank you so much for being here with us today. One more time, here's the information about the golf tournament. The 2025 Jernigan Memorial Golf Tournament begins with an opening celebration Sunday, May 4th, and golf play the next day. For more information, call 706-667-0030. Registration is now open.